Well, so they can be from nothing. There can be, some people drink every day and have no adverse consequences ever from that. In pharmacology, in pharmacology, which is the science of drugs, and either how drugs affect you or you affect the drugs. Those are sort of the two ways that you can think about pharmacology. And in the science of pharmacology, the dose is the most important variable, right? So if you drink every day and you don't get severely intoxicated and you don't have any any long-term, you don't have any behavioral complications from that, you don't have, you're able to work, you're able to maintain your relationships, you're able to function in society, you don't have any legal complications, your weight stays relatively stable, you feel good, you sleep okay, right? You're not having any sleep disruption, then daily drinking is probably not harmful at all. Okay, not harmful at all. The World Health Organization has thought this through quite a bit and has defined risk levels which are considered acceptable for and healthy. And that risk stratification says that 1 drink a day for women, 1 standard drink a day per women, and 2 standard drinks a day for men are likely not to have any significant health impacts on people. Okay. Now having and above those levels, you can show that people do have health impacts from their drinking. So let's say you drink 4 drinks a day for 20 years, right? What is your risk? Well, your risk is about twice what it would be if you didn't drink at all for a host of conditions. Doesn't mean you're absolutely going to develop any of those conditions, right? But it just increases your relative risk of having them. And those could be like high blood pressure, sleep apnea, breast cancer, colon cancer. The list is actually huge of diseases which excessive drinking can increase the risk of acquiring or suffering from. So dose is the key variable, and keeping the dose down to some acceptable point is our current recommendation. If you want no risk at all, so risk does start, there is a linear relationship between drinking and all adverse health outcomes. But again, it rises so little at these levels as to be considered kind of noise, not much worse than background. I mean, there's always a risk you could have a car accident, right? Every time you drive, there's a risk of a fatal accident. I mean, it's calculated, number of miles driven per fatal accident, right? But in most cases, most people wouldn't say, well, I'm never going to drive again because there's a risk of dying in a car accident, and so the same with alcohol. There's always a risk of an adverse health outcome with alcohol, but acceptable risks are within these boundaries of 1 drink per day for women and 2 drinks a day for men, or more accurately, 7 drinks for women per week and 14 for men. We don't know, but we presume that if you have, like, say, 4 drinks on Friday night and 3 drinks on Saturday night, right, as a woman, that you're in your safe zone, right? But the numbers are expressed as per day, right? But per day over a week, right? So it could be that, like if you had all those drinks in 1 day in a week, you would have no bad health outcomes. We don't know the answer to that, right? But so ideally staying below 2 drinks on any 1 day for men, or 1 drink on any 1 day for women, best, right? But it is 7 per week and 14 per week for 7 per week for women and 14 per week for men, right? So that's the current recommendation of safe levels of drinking.
For expert support on medication-assisted treatment for alcohol use disorder, visit riahealth.com.